So first, that what is aerosol therapy? What is aerosols? Aerosols means that suspension of the liquid or solid in the gaseous medium. For that, to deliver the aerosols, we need a aerosol system. It includes the aerosol generators like nebulizers or MDI. Then we need sometimes with the additional equipments like spacers and all. Before going to that, discuss about the aerosol therapy, you should know the two important definition. One is the emitted dose. Emitted dose means amount of drug exiting the delivery device, whatever that it's nebulizers or it may be a MDA. So amount of drug exiting the delivery device, it's called emitted dose. Second is in this emitted dose, how much of the particle, mass of the particles below the cutoff diameter, we call it as a fine particle fraction. For example, our target cutoff is less than 5 micromillimeter. If in the emitted dose, how much of the aerosol particle is less than that 5 micrometer, we call it as a fine particle fraction. So third one is the lung bioavailability. So lot of things other than the device, if example emitted dose and fine particle fractions, all depends upon the aerosol generator, our type of nebulizers and the flow to the nebulizers or humidification of the ventilator circuit and the flow gas density, all will affect that in the fine particle fraction. But lung bioavailability, it's more depends on the patient. If example, my patient is having very narrow airway, there will be high resistance, it causes more turbulence flow, the most of the particle will deposit in the proximal airway. High anatomy and the physiology of the lung mechanics will affect the aerosol therapy. Second thing, blood supply. What is our target site? If example tracheobronchitis, if we need a target site is first 10 generation of our bronchioles. If it is the pneumonia, that our target site is alveoli. So it depends upon all these factors, emitted dose, fine particle fraction, lung bioavailability. So all will determine the effective aerosol therapy. So if you deliver any device, if you use a nebulizers or MDA, it emit the aerosols. These aerosols will reach sometimes it reach the trachea, bronchiole, sometimes will reach the alveoli. How it is reach the target site? There is a three mechanism. First mechanism, impaction. It occur at the high flow settings. For example, that initially in the large airway, at the first 10 branching of the airway, the flow will be very high normally in the patient with positive pressure ventilation. So if it is that in those settings, the most of the aerosols will deposit in the proximal airway. It's a 10 branching of the airway by the method called impaction. So which clinical conditions you need a aerosol therapy in the proximal airway. It's a 10 branching of that, especially patient with COPD, asthma or patients with tracheobronchitis. Once it reaches the distal 5 to 6 airway generations, the flow will be obviously compared to this place, the flow will be decreased. Then flow decreases, that aerosols will be sediment. So it is a mechanism to reach these bronchioles, 5 to 6 distal airway generation is sedimentation. The third one is the diffusion method at the alveolar level. Alveolar level, usually its flow will be further decreased. So the drugs will reach, the aerosols will reach the alveolar level by the combination of sedimentation and diffusion. For example, I want to deliver most of our critical care setting, you have to reach our drug to the alveolar level. For that the alveolar level, the flow will be low, the particle will be smaller. So smaller particles only reach the alveolar level. First, what are the aerosol devices we can use in the patients on respiratory support? First is the nebulizers. Nebulizer, there is a 3 types of nebulizers we can use. There is a jet nebulizer, ultrasonic and the vibrating mesh. The second other devices we commonly use in critical care is a pressurized meter dosage, it's a MDI. Some of the other MDIs, recent hydrofluorocarbon MDIs are also available.